So how do you feel that we can best get the word out? Because I think that a lot of patients may be a little sensitive about thinking about exercise while they're going through treatment. And as you mentioned, you're not trying to get people to prepare for a marathon. You just want them to keep engaged. So how do you think we can best get that information out to patients?
Yeah, just like we advocate with all the advocacy groups on the importance of factors in long-term survivorship, the advocacy groups have pushed research. The advocacy groups have pushed screening. When you think of every aspect of the diagnosis and treatment of breast cancer, who's been the number one supporters of all this? It's been the advocacy groups, people who have lived it. So making people aware of what we're talking about here, perhaps the advocacy groups even linking up to cancerfitness.org website or telling patients about it. What's so fascinating, and this is the rest of the backstory that's emerging now, you've got 35 years worth of improved clinical outcomes, right? The question then is, what's going on at the physiologic level in the body to give these improved clinical outcomes? And there are two areas of focus that I want all of you to be aware of. Number one is our muscles. Our muscles are more than parts of us moving our body and our bones around. Our muscle, every time we just even moderately exercise, walking briskly, working out with free weights, resistance bands, going to the gym, playing pickleball, swimming vigorously, you name it. Just keep moving. Every time we're moving like this, our muscles are releasing things called myokines. MYO meaning muscle kines, meaning proteins, and polypeptides. So the myokines, we now know, have an anti-inflammatory effect on the body. And we know that chronic inflammation is actually one of the things that probably leads to the development of cancer in the first place, let alone obesity and other factors. But the myokines can also have a direct anti-tumoral effect on cancer cells themselves. The myokines stimulate the central nervous system to help prevent dementia, help with chemo brain and things of that sort. The myokines obviously stimulate the cardiovascular system to make it more healthy. Importantly, the myokines also stimulate the gut and the gut biome. And we know a healthy gut biome is really important in long-term survival, don't we? So the effect of this is really amazing. The other system being stimulated is the immune system. So every time, again, we're moderately exercising, our immune system is kicking out more killer lymphocytes, more anti-tumoral factors, more other benefits that help obviously fight off bacterial infections, viral infections, but can help reduce cancer and improve survival. Now, if the future of more and more cancer treatments is going to be targeted immunotherapies, then does it make sense to enhance the immune system before we even give the targeted immunotherapies? And that's a focus of some ongoing clinical trials right now. Okay. So we now literally exercise is medicine. We are literally putting out, when we exercise, factors that are so important, not only to heal from cancer, but to heal from so many other things that go on in our body. Does that make sense? I hope.
Oh, it definitely makes sense. So how soon after someone has had surgery for breast cancer, how soon would they be able to start partaking in some type of exercise activity?
Yeah. So I just one other. I answer that question in just a second. But one other definition for everybody to make it clear: there are really two components to exercise oncology. One is the medical center component. the prehabilitation during active treatment and immediately post. The other is long-term survival. Survivorship can go on out in the fitness industry. What we try and do at the medical center level is have physicians refer patients to physical therapy departments that may offer these activities, to those who have their own exercise oncology programs. And the referral should go to certified exercise oncology specialists. These are typically graduates of exercise physiology programs, kinesiology programs, sports medicine programs that then are certified to work with cancer patients. They can be certified by the American College of Sports Medicine and other groups, including Maple Tree Cancer Alliance. What we're trying to do then, Sylvia, is to create a personalized, individualized prescription for each patient. That's part of the answer to your question about when do you start, okay? Obviously, during active treatment, we know that people need to recover from surgery for a good 6 weeks or more, but that doesn't mean in the meantime they can't be walking, they can't be moving. And one of the things we've learned is that any movement is better than no movement, okay? Any movement is better than no movement. So after chemotherapy, if you feel like crap, great, go rest for a couple of days. But once you get through that acute phase, get moving. Whether it's walking around the house, walking around the block, getting with a partner, walking outdoors, whatever it may be, please just get moving. And then the certified specialists then individualize some of the resistance training activities that can go on depending on the type of surgery patients have had, getting clearances from their physicians that they can, in fact, start maybe some stretching exercises. We obviously, in breast cancer, I've always encouraged people when it comes to mobility of the axilla, things like that can start early, obviously, et cetera, et cetera. So it's individualized. And also that prescription is based on what was the baseline activity of the patient pre-diagnosis. Does that make sense? Okay.
Yes, it
I
does.
I can see the cameras on and several people, and I know I'm getting through it. Oh, okay, yeah, I get what he's saying.
Yeah, no, we definitely that does make sense. So, what overall do you see being the long-term benefits for breast cancer survivors gaining from staying active?
Improve survival, improve quality of life, and improve mobility. Let's just talk just for a minute, just separately for a second about longevity. Obviously, all of us want to live longer. We're all concerned about our longevity. Forget the cancer diagnosis. What are the factors that are really important to improve our longevity? Forget cancer, okay? And what it boils down to is lifestyle medicine. It talks about balanced diets, uh, fighting obesity and losing weight. We can talk about GLP-1s here in a minute, which is having a big activity right now in the breast cancer world. Um, Social connections, just all sorts of things. But a diet and exercise are really key to all of this, okay? And so that's where we begin. And then when it comes to the patient who's had surgery, obviously recovering, waiting till drains are out and certain range of motion activities. But as an example, we're always worried in breast cancer about the potential of lymphedema. That doesn't mean that you couldn't be using a hand device or a little free weights on the arms that have been done while you're healing and working your muscles in the arm to help increase lymphatic flow back centrally, okay? Things of that sort. But whatever it is, please just move, okay?